Launching an AOT program begins with bringing together key leaders of the treatment system, the court, the mental health advocacy community, and other collaborators who have knowledge of the community, including its current resources and challenges. The purpose of the initial meeting is to have these key leaders commit to exploring the feasibility of establishing a program in the community. This buy-in is crucial to the functioning of the AOT program. In their work providing technical assistance to AOT programs across the country, Treatment Advocacy Center's AOT implementation team most often sees AOT programs break down because there was a lack of buy-in from all key collaborators at the outset. Today, you're going to hear Leslie Carpenter, Johnson County, Iowa's AOT champion and advocate, and Lynn Rose, Assistant Johnson County Attorney, discuss the challenges they faced when seeking collaborator buy-in and how they overcame those challenges and achieved success with Johnson County's AOT program.
So some of the key collaborators that we thought of to work with initially were members of the provider community, people who provided treatment for substance use and mental illness treatment, the local hospitals, both the VA hospital and the University of Iowa hospital, local law enforcement, the shelter house who was providing support for our homeless community. And obviously, we started engaging with the county attorney's office and meeting people like Lynn. Lynn?
Yes, for us, from our perspective, the most important key collaborator really was the sheriff and the jail, since we knew and understood that we were seeing a high number of people with serious mental illness cycle through the jail. And we wanted to be sure that we brought law enforcement to the table from across the county. And that was our big contribution, I think, in that regard. But we also were able to include decision makers in county government who have authority to make decisions about how to spend money or allocate resources. And that has been important as we've moved down the line and tried to make decisions about when and where the court meets and those sorts of things.
Very true. And one other point I want to make is that at the beginning, I didn't know who a lot of these people were. And so some of the introductions to some of these key people in power were actually helped along via the relationships that I had with the legislators that helped us to pass the improved commitment law in Iowa. They were the ones that helped us to engage and find the people that we needed to reach out to. And also, as we went along, we kept asking, who else do I need to include? Who else do I need to inform? Who else do I need to engage with?
Each person that came to the team allowed us to not just identify an agency stakeholder or an entity, but actual people within those agencies and entities that were the bodies that needed to be around the table. So we did a lot of coalition building on the front end.
So in getting organized for our first meeting, we actually had someone who was an official person who was the jail diversion director at that time for Johnson County Sheriff's Office. And we had her be the leader because at that time I felt it was important for an official person to be calling these meetings. And the key people we brought in were Lynn from the county attorney's office, the executive director of NAMI Johnson County. We brought in a few of the local healthcare providers, the mental health care providers, and we had somebody there from the shelter house as well. And I may be forgetting somebody, but it was a smaller group.
We also had people from the VA hospital, and we had people from the UIHC hospital too, Leslie.
We did. And over the course of time, what we did is we engaged with each person to start building out who all we would be inviting to these meetings. And referring back to that white paper about building out an AOT implementation team, many of those different collaborators were listed. And so we kept trying to find the right people from each of those different entities to engage and bring in.
So one thing that is unique in the Iowa Code is that Chapter 229 of the Iowa Code is all about involuntary commitment for folks who have serious mental illness. And that chapter in the code provides that a county may hire what is called a judicial referee. And that's a judge who has jurisdiction limited to chapters about involuntary commitments. So our judicial referee is who we ended up hiring someone in that context as a judicial referee. And this let us solve several challenges. And so we made a proposal then that said, we will have a judge for our AOT program, but the judge will be a judicial referee. And we had a lot of support from our county officials, which I had referenced earlier, which also facilitated us being able to hire a judicial referee. Certainly, the idea that there's one way to run or establish an AOT program would be a limited way to think about it. I think that there are a variety of ways that one could approach this. And we used the tools that were available to us here under the Iowa Code to make it happen. But my attendance at the symposium allowed me to understand that there are different jurisdictions handle this differently, and that there was more than one way to find how to have a judge with jurisdiction to work in this kind of program. And that was appreciated. We expected challenges, or at least I can only speak for me. I expected challenges. One thing that I do really kind of recognize as a privilege of living in the community where I live, the county where I live, a challenge that I did not expect was that there would be a lot of resistance to this idea locally. And that has been borne out. We have enjoyed very good support, even if that support is no one's deliberately interfering or trying to stop it from happening, because that could probably happen some places. So that is not a challenge we had to deal with, and that's important to recognize. But I also think that's a function of how hard we worked to build a coalition and be collaborative.
One of the other obvious barriers initially from some of the providers was, well, we're so busy, we're understaffed, there's a workforce shortage, we don't really have the capacity to build out a new program. And what I countered with was, well, these are people that you're already interacting with, people that you're already trying to provide treatment for. Having the AOT process and program allows you to be more efficient with your time in serving these hard to serve clients who are usually not adherent to treatment. Getting them in this program provides the mechanism, the means to try to engage with them in a more effective manner, and their outcomes will be better, so it'll be actually less strain to your workforce and to your agency. And it didn't take very long for them to come along and see that with us.
So how do you address the doubts of key collaborators? This is not a naive answer. It's that you engage in continued conversation around it. And it wasn't just, what Leslie says is correct, but that wasn't the only thing. It was continued discussion. We provided data that had been made available to us through I think the TAC team was able actually to provide some data at some point, but the Treatment Advocacy Center generally has data available, and we were able to talk about those things in a way where, if you've got a scientist at the table, being able to talk data is helpful. And so bringing information to the discussion proved helpful. It was also useful to pull out your advocacy skills, whatever they may be, and then being able to say to our institutional partners, this ain't costing you a dime. I'm not in your courthouse. I'm not in your hospital. I'm not asking your personnel to come here to my conference room where we've got money through the Mental Health Disability Services region. This is a grant at this point to fund the pilot program, but this is what we're going to do. We're going to fund these things. What I'm asking you for, institutional partner, is your expertise and your cooperation. And I think that was actually critical to being able to talk to those folks and get buy-in.
I think another important point to make here that I've neglected to previously is that having the AOT implementation team with us along the way at the majority of our planning committee meetings and the early implementation meetings has been hugely helpful. You help to provide validity and credibility to the AOT program that I, as a volunteer advocate, couldn't do alone. And it really helped us in the process. With the regular meetings, we tried to provide an agenda to let people know what we'd be discussing, or if we were having a guest come to talk with us about something. And that regular scheduling of the meetings was really helpful, so that people could put it into their calendars, plan for it, and easily schedule around it.
One practice that we had was that we were diligent about picking our next date at the end of each meeting. Sometimes we even would pick it at the beginning of the meeting, but at that meeting, at a meeting, we picked our next meeting date. And I think that was an important thing to do. And I agree with Leslie that having a regular agenda was meaningful, because that allowed us to think through what should we be talking about. And we got better at it as time went on, because, maybe you don't know what you should be talking about at the first or second meeting, right? You got to kind of find your way. But having the agenda gave us a way to focus on those kinds of issues, and that was helpful.
And I would add, just as we were closing meetings, if each of us had something that we were going to specifically follow up on before the next meeting, we would reiterate that, reviewing of our next action steps. That's a really helpful thing to move a process along and help people feel like we're doing something, going somewhere.
Another thing that we did with our meetings, we didn't do this with everyone, we didn't need to, but if we identified an obstacle or a challenge or a question where we needed more information or expertise, and no one around the table was the person who could do that, we made it a point to seek out those folks in the community and invite them to our next meeting. And then a chunk of our agenda was the series of questions for that person. Don't be afraid to identify someone in your community that you might think is a local expert who doesn't have time to be on your committee but can come and help you once in a while. We did that with some regularity, and I really appreciated that.
The first step towards starting AOT is establishing buy-in from key community leaders. Not only are they important collaborators in care, but they also have knowledge of the community and its existing resources. Their buy-in is crucial to program success. Today, we heard Leslie Carpenter and Lynn Rose discuss this process in the establishment of the Johnson County, Iowa AOT program. We hope you will take their lessons learned into account when starting AOT in your community. Treatment Advocacy Center's AOT implementation team provides technical assistance on AOT to jurisdictions across the country. For more information on those services, please email aot@treatmentadvocacycenter.org.